Hey guys, welcome back to another medical video. Today I want to talk about tampons and their use in a medical emergency. I see this offered up all the time as a solution to treat a medical emergency, specifically a puncture wound, a gunshot wound, something of that sort, maybe stab wound. We're gonna look at tampons and what they are for considerations in that scenario. I want to explain why I don't carry these, why I never will. These don't replace this, and we're going to look at why. We're going to run a little test, and I'll prove it. So, first, let's tear these open. Take a look at what we're dealing with here. This is probably what people would throw into their medical bag, and that's what we're dealing with. For you guys who's never seen one, that's what they are. The way they work, it goes in, this gets deployed, tube comes out. It's not even gauze, it's cotton. So the rayon and polyester and polyethylene, that's going to be like your poly rope. This rope is poly. The cotton is this guy. This is a standard cotton ball. There's a fine layer of gauze around the outside. Kind of hard to see, but there's a fine layer of gauze, and then this is really just a cotton ball. It shreds like a cotton ball, it feels like a cotton ball, it's just a cotton ball. So when we compare that to a real roll of gauze, the gauze doesn't have little fibers or shreddies or anything that's gonna shred into fibers like this. See how this just comes apart and there's just wisps of fibers coming off of it? The gauze doesn't do that. There's a reason for that. But if we unroll this bad boy, we've got a lot of gauze here. And that's a small roll of gauze. So, there's already, you can tell, even with just a small roll of gauze, that there's far more surface area to this than there is to this. And here I have a slightly bigger bandage, slightly bigger roll of gauze. So this one is a denser gauze, and there's a lot of it here. So if I were to unroll this and wad it up, that's a lot of gauze. Compare that to this. Let's get a new one up. What you're really paying for in these things is the applicator and the fancy little tab, which if you have a gunshot wound or a puncture wound, pushing this in there, not ideal. Especially this part right there. So, here's one that's all compressed. I mean, it's really about the size of my pinky finger, even a bit smaller. Significant difference in absorbing quality right there. And that was one small roll of compressed gauze. This is a combine pad. So these pads are not meant to go inside the body. These pads are meant to go on a wound. They're very small when they compress up. It's X-ray identifiable with this strip. And these have basically gauze inside them, or a bandaging material that's on a nice pad that's easy to apply. The one thing you have to keep in mind with gunshot wounds is they're a deep puncture wound. There's a lot going on with them. For most people, the idea is going to be control the bleeding and get to a hospital. Putting this inside a gunshot wound is not going to stop the bleeding, is not going to control the bleeding. These do not absorb a lot of material. These are trauma bandages. We're going to tear this open and take a look at what this one entails. Now this is for major wound. There's a built-in pad. It's highly absorbent. It's very thick. And then we have all this bandaging. And then at the end, we have this clip. This clip is to secure the bandage after you finish wrapping. So if I was going to try to treat a puncture wound or a gunshot wound in the field, I'm not reaching for this. I'm reaching for one of these, combined with one of these. So if I was addressing a wound, a deep puncture wound, this is going on, and that's going to do a lot of absorbing. Then I take my bandage, place that over the top, and then we're going to wrap to the end, and then we're going to secure it with the clip. And this is a pressure dressing. You want this wrapped tight. What controls bleeding in a wound situation is pressure and absorption. This is not going to form clotting on the inside. There's another reason why we don't want to use tampons in a gunshot wound. So if I've got a gunshot wound like this wound and I pack this down into the wound, it's just a cotton ball. So this is just going to shred and leave strands and fibers on the inside that we don't want. If I've got a gunshot wound and I feel like I need to pack it, if it's really bad and I don't have the ability to apply a tourniquet, if this is a lower torso shot, then you're going to take your gauze and you're going to have your wound, and this is going to suck for the person who's been shot, but it's already sucking, so it can't get much worse, right? And I'm going to start packing that wound, and I'm going to push as much of this absorbent material down in there as I can. And you just keep packing and shoving, and if it's a through and through, then you do it on the other side as well. Keep packing as much as you can. Now I've got the wound packed. What I'm going to do from there to help control more bleeding is I'm going to take my pad or my bandage and I'm going to apply it over the top. You know, if this is an abdominal wound, this is an ABD pad, a combine pad. It's basically made for this. Put that over the top. Take my other bandage, put that over the top. Wrap. This will hold. The whole idea with this clip is that you can wrap this very tightly and it will maintain pressure. Pressure and absorbent material, that's how you're going to be able to handle this stuff in the field. The real treatment is going to occur at an emergency facility. This is expedient field care for a gunshot wound. So I would take this and then I would just wrap this bandage as much pressure as I possibly can. You keep going through this all the way around. This is very hard to do by myself, but you're just going to wrap as tight as you can all the way around, over and over and over. I'm doing it messy just for the video. And then you have pressure and a lot of absorbent material. So I've got all this packed down into that wound. That is a lot of material. A lot of material. Significantly more than this. And yes, you are going to have to stick your fingers in there. So what should we wear? Gloves. Now, what I'd like to do is a little test just to show you guys the absorbent qualities of this versus one of these versus gauze. Approximately 300 milliliters of water. That's pretty well absorbed. That's about the max you're going to get out of this. So we've got just a hair under 300 mils. So this absorbed probably somewhere in the area of about 25 mils. Yeah, about 25 mils. So this absorbed about 25 milliliters of water. Now, if I was going to use my gauze, So my gauze is now absorbed. It's hard to do this at an angle. We absorbed almost 100 milliliters of water. So even this small gauze roll absorbed almost 100 milliliters of water. The tampon absorbed about 25 mils. So already you're seeing a big difference in the absorption qualities of a tampon versus the absorption qualities of good quality gauze. Next, let's try our combine pad. We are about at 250 mils in here remaining, so that gauze is still holding 50 mils of water that I haven't squeezed out. Let's try it with the pad. Let that soak up for a second. So the pad, we are down to 200 mils. So the pad absorbed 50 to 75 mils. That says 200 right there. So we went from about 250, 275 to 200. So this holds about 75 mils of liquid. Again, the tampon only absorbed 25 mils. So anything is going to be more absorbent, really, than that. So this didn't absorb much of anything. This absorbed about 25 milliliters of water. It's also, now that it's wet, it's starting to come apart really easily. So what that says is that if this is in a wound and the blood is sticky, especially when it starts to dry, and you need to go and remove this so you can either get the bullet out or they're at the hospital or whatever, they're going to be pissed if you show up to the hospital and you've got one of these stuffed in a gunshot wound. All of this fiber material, just once it's wet, starts coming apart. I mean, it really starts shredding. I'm not even barely putting any pressure on this at all, and it's just shredding apart. I hope this video kind of illustrated why we don't want to be using tampons for treating gunshot wounds. The bottom line is these are not appropriate for any kind of medical problem, medical emergency. These are for women, for menstruation. These are not for wound packing. Let me put it this way. If you've got a wound that's big enough where you can insert this applicator into the wound and then deploy the cotton, that is a deep, large radius wound. The deep, large radius wound, if you can fit this in there, you're already at this level. You're at the packing stage. If you can fit this into an open wound, this is going to do far better, and it's going to work more appropriately for the situation. This works. This works. This packed in, this over the top, this wrapped around it with a lot of pressure. Push come to shove, if you're in a real emergency and you don't have any of this stuff, take your t-shirt off, wad it up, and press it on there and hold it with as much pressure as you can. Pressure and dressing. These you can't put pressure on. They're already down. They're down in the wound. And once they're saturated, it's still going to continue to seep. You can't apply pressure to the bandaging. With the gauze, once it's in there, you can apply pressure, which helps closure, and then you pack the wound on the top. So I hope this video kind of illustrated why we don't want to be using tampons for medical emergencies. I always recommend, guys, get training, take a Stop the Bleed class, get some knowledge. There's lots of videos on YouTube that will introduce you to the principles of Stop the Bleed. Obviously, getting into a class is going to be the best. There are emergency responder textbooks that you can buy, and you can do your own home study. It'll at least get you familiar with the ideas of what we're talking about when it comes to a medical emergency, and you'll see why these are pointless. So, if you liked the video, please leave me a thumbs up and subscribe for more. If you have any comments on this, feel free to leave it in the comment section below, and we'll catch you guys in the next video. Thanks.